Raipur Airport. Raipur Airport. Okay. You have opened the other one.
Now you can start, sir.
Okay. So just I'm sharing it. Just check it. So good afternoon, everyone there. It's a pleasure to actually come back to you from Bangalore, Nimans. And today is not my session. Today is not my day. But due to certain circumstances, I'm coming here today to actually connect with you. And again, we are going to reconnect on this topic of psychological support, psychosocial support in CBR and emergencies. And today, a very interesting issue which I'm going to share with you. And one must all know this, because all these days and all the lectures we were talking about how people are impacted in the CBR and emergencies, incidents, or disasters. But this is today I'm going to talk about how we as a first responders, how we as a onlookers, how we as a stakeholders, or whatever the capacity we are there in an CBR and incident, what will happen to us? Whether how much is going to be the effect on you, people like you or people like me who are actually working in this area, and how this actually can impact your own health and mental health, and what are the ways actually and means to actually identify that and same actually that. So can you actually see my PowerPoint?
I think it's not displaying. I'm copying it up.
Okay. So it is there already.
No, I tried opening it. Can I copy it?
Yeah, it is there in the download. So today is about, you can call it a self-care of caregivers, stress management for caregivers, or how to care the CBR and responders or the first responders. So there are actually a whole gambit of terminologies being used. To put it simply, that how people who work in such scenarios may affect it. So that's all actually that. So anybody, now I would like to actually put it on your chat box. If CBR and emergency happens, or a CBR and incident happens, how the first responders may be affected. Can any 3-4 of you actually can scrap it? What are all the ways they will get affected? Your time starts now. Let's actually do this exercise quickly. 2 minutes time. Any one of you can actually put it in your chat box, how these people will get affected, whether it is in the factory or whether it is in any public utility place, or it is actually in a laboratory or whatever it is. So when these sort of incidents happens, how people generally get affected who are responding to these things. Can you just put it actually on the scrap chat box, please? 2 minutes I'm giving you.
Can I forward it to my mail, sir? It's not opening.
Why?
I don't know.
It should be here also. CBR.
I don't know, sir. It's not opening.
So anybody who wrote? So I expect some response from you. What are all the ways people, first responders, people who work in these sort of scenarios may get affected? Kindly actually give me some inputs on that. Anything, whatever you feel, you please write it in the chat box. So far, no one has written. I hope you're all there listening to me, because I can't see you. We trust and we hope actually that you're all listening to me. And I'm again, third time I'm requesting you, kindly put that in the chat box. what are all the ways responders, caregivers, it may be a medical first responder, or it may be a rescuer, or it may be whatever, how these people may get affected in such a scenarios, because you have been keep listening about CBR and disasters. So many weeks, so many CBR and experts spoke to you. What are all the ways community is affected, individuals are affected, society is affected? So now I'm asking you. They must have spoken about who are all responding to it, how they are responding to it, in what way we have to respond. So kindly give me in chat box how people who respond to such scenarios may get affected. 2 minutes, already 1 minute is over, please. I'm not finding any chat there. Anybody, nobody's writing there. So you should be writing it after so many classes. So you should be actually a disaster management CBR and expert. Lot of inputs have gone into the classes. So please actually write, scrap it actually that. I'm waiting for you. Yeah, 2 minutes. So it's going to get over. No response so far. You can also talk to me also. You can actually switch on your mic and you can actually also tell these things. How people may get affected. Responders. Yeah. Are you all there or not? So no message. Nobody would like to actually ask anything or tell anything or message anything. We are not actually conducting any game in exam. We are just asking you, what is your understanding that how people who are responding to such scenarios may be affected in such scenarios? And very interesting it is. Nobody wants to say anything. Are you there? Actually, all of you are there or not? Anybody actually say something in the chat box? Are you there? Are you listening to me? Or I'm talking to quite actually it is. Can you, I mean, may I request anybody to at least switch on the mic and say actually that you are all there? Or what you expect from me in this next half an hour? Anybody would like to actually tell me on this aspect of stress management for CBR responders? Anybody? Any message? I'm not getting any response. Okay, anyway, then I will not wait for more because I'm also losing time. I have very little time to actually talk. So then, if there is no response from my side, the other side, so I'll just actually speak about certain important aspect of stress management in CBR and scenarios. So, although I have a PowerPoint, nobody actually asking me anything. What do you exactly you want? What do you would like to actually learn? What do you would like to actually do this? I hope and trust actually that you're all actually there, and you have actually gone through all the sessions. And in CBRN scenario, like I said, it's a highly stressful sort of a scenario. It is not a normal sort of a scenario. And whoever actually encounters this or experiences these sort of CBRN scenarios undergo enormous amount of stress and distress. Stress is because these CBRN scenarios can't be seen, cannot be actually felt, cannot be smelt, cannot be actually this one. So that is where actually that CBRN scenario is very special. So you require actually the emergencies come all of a sudden, and you may not be actually very well equipped to handle it, or you were actually having that protective gears to actually to handle it, or you have the adequate resources, time, and other things to actually to manage it. So these three things actually makes it CBRN scenario is actually one of the most challenging jobs actually to handle it. So under that circumstances, what is that you will undergo? An individual who is responding to a CBRN disasters will undergo multiple level of impact and stress. For example, if you recall actually that when I was talking about how the individuals, how the people will undergo, a group will undergo impact, like physically, by bodily, they will have large amount of impact in terms of maybe injuries or in terms of various bodily complaints, physical complaints, somatic complaints, and all those things. Here also you will be exposed, because whether it is actually the people who are affected in CBRN disasters or people who are responding in CBRN disasters, all of them are exposed to the same chemical or the same nuclear or radiological this one. So the exposure is actually of the same only, but only difference is that you may have a certain amount of protective gear with you, or may not be having a protective gear in terms of if it is happening very, I mean, it happened in a spurt of movement. So that is where actually that the psychology, physically actually you are more vulnerable as equal to as anybody who is affected in a CBR and emergencies. And psychologically also, you will also actually have same sort of a fear, same sort of a anxiety, same sort of a panic as anybody else. And also, you may be, not only you may be affected, your colleague, you are actually the team member may also be getting affected. So recently, we saw it in COVID, how actually the doctors were affected, how the nurses were affected, how the health responders were affected, and they need to be quarantined. So many doctors lost their lives, many nurses lost their lives, many of the first responders lost their lives. So in CBR and emergencies also, you may lose your colleague, or you may lose your colleague to some injury, or the colleague may be actually affected, need to be actually segregated and withdrawn and put into quarantine, or decontamination. So all those things actually this process will happen. So the large amount of psychological stress also actually they are actually exposed to it, prone to it, because of all these things are happening. And like I said, they also actually there will be a loss of routines among the first responders or people who are actually handling these sort of emergencies, or they may not be able to go back to their homes, or they may not actually do their routine work both at the family level or at the actually the work level, or at the anywhere actually. So the it actually affects on the relationship, because they can't go home. In COVID, you saw actually that many of us actually didn't go home for many months, 1 month, 2 months, 3 months actually we could not go. So because one is actually that the higher load of work. Second is that fear of not to contaminate our own family members who are elderly, who are sick in our own homes. And third is actually that we also had to carry a lot of stigma. So CBRN workers also carry stigma that in COVID you saw that many of the health workers were not welcomed in their societies, in their apartments, or in nearby localities, neighborhood localities. So that is also actually become a very major issue actually, that although you one side you are working for people's welfare, people's well-being, but you are not most welcome. You are actually told to get out, you told to vacate, you told not to enter, you told not to touch, you are told not to go near to them. So all these things actually CBRN disasters can actually expose. And that is where actually that people people will be more stigmatized in that this one. So and added to that, your whole routine actually comes for a standstill. You can't actually go to your family. You can't function as a father or as a brother or as a husband. Whatever the work you have to do, it may not you may not be doing it actually, that because you are away. You can't just go just like that, because you have to undergo a lot of process, contamination, decontamination, quarantine, and all those things. And added to that, there may be some family emergencies or family functions. So all those things actually there is a disruption in these things. So this also actually brings in a large amount of stress. And added to that, again, your own actually routine also actually goes for a toss. It is just not about the family's routine or your work routine. It is your own routine. So you can't go home. The way you went for a walk, you are not able to walk every day, morning or evening. So you are supposed to go for a outing or anything. So there is actually a large amount of change in your own personal routines also. So it actually, you look at it actually, that people who are responding to such incidents actually gets affected in so many ways. It is just not about the work occupational areas. Of course, occupational area is very, very challenging, but look at actually the other domains of their life. So that is where actually that people who are responding, who are working in such scenarios, will have a larger amount of stress, and in spite of all these things, they have to work. So COVID, we have seen most of the first responders, health responders, medical teams, and all these people were exposed to these sort of things. So what happens here actually? That because of this, first, and I told you, you are more. I mean, you are as exposed to any survivors in a disaster or who are affected in a disaster. So there is a not a much of a difference between you are responding and who are actually already affected. Only thing is that the time duration actually differs. They were affected early. You are going there actually to provide care, and then you started seeing this. You started helping them. You started actually staying there. You started actually not going out. You were they staying there for a longer period of a time. This is not just a 9 to 5 job. You can go back home in the evening. You have to stay there full night or 2 nights, 3 nights, indefinitely. You have to be there. So we don't know actually that when you will go back, and exactly actually that these all things actually cumulatively come on your own well-being. So the very first day or something, you will go there with full of josh, full of energy. So people are affected. I want to go and help. I want to be there, supportive. I can be of some use. So you feel actually a lot of good things about yourself in the very first days. So this is just like actually a state of niceness, the well-being. You yourself feel very good about yourself. You're there going there actually to people who are already suffering, who are already in pain, who are already actually in need of some help. So this is where actually that the first level of entry you will have it. So after that, what? So first day, second day, it will be fine. So slowly, actually, as I was mentioning, slowly your own routine also will start actually changing, and probably your food pattern, probably your sleep pattern, probably the duration of staying there. Look at connect with the COVID recently. These were all happening actually to those first responders or health responders, and in this scenario, and then you suddenly actually you have to stay there only. You're not going out. You don't take a break. You don't go for a chai. You don't go for any other things. So you are not listening to music. So you are actually wearing some protective gear, which you will not be able to communicate properly. So all those things actually that were happening. So definitely actually that the very first day how you went inside this locality or that scenario, that the type of actually energy you had, the type of motivation, morale you had to help these people, slowly actually started will be now actually that, because suddenly actually you will start thinking about your family. Suddenly you will start thinking about, I have to take my daughter there or son there. I have to take my father there. I should have taken an appointment. So all these things start creeping in your mind actually, that till that time you may not be actually thinking of all those things. And added to that, there will be a lot of pressure actually for you from the people who are affected there, from your own higher ups. There will be people who will be visiting in that scenario, and people will be actually asking you questions. People will be asking you to actually complete certain things. So your mission, your actually task aspects, so everything will come into play. So something which is actually going to actually demand lot of actually effort from you by the time you would have actually already drained. So that is where actually that it comes very the stress is actually comes importantly on the first responders. So your functionality, so the way they efficiently you function in the first 24 hours or the 48 hours, you may not start, everything will be actually sliding actually, that the third day, fourth day, fifth day, because this is not a daytime job. You go and come, because as you all know actually that what sort of a scenario we are handling it. So that is where actually that the issue comes. Then your sleeplessness comes. There is a change in your biological functioning. All your basic biological parameters, your sleep, your appetite, other bodily functions, basic functions, there will be a change in that. Definitely there will be a disruptions. So then you will start actually getting frustrated, your anger, all these things are normal. But in that sort of a scenario, it will start scaling up actually, that when you are actually handling any difficult situations. So that is where actually that which we may not be mindful also. What is the change which is happening in our body? What is the change which is happening in your mind? What is the change which is happening in your thought process? What is the change which we are feeling in our feelings, the emotions? So this is actually everything will be changing. Even in our behavior, we may not be understanding it. We may be actually very irritated with people. We may be actually there will be outburst, but it is just not the person outside person. So this, it is your own frustration. It is your own inner feeling actually manifesting actually like this sort of a outburst, this sort of a behavioral aspects. So there will be a change in all this actually parameters. So this is all actually that the stress reactions actually that we need to be mindful of it. So which is very difficult in such scenarios. So first and foremost, actually, that how to actually handle these sort of a thing is that to understand and identify, recognize these changes which we actually undergo in your bodily, thought wise, emotion wise, behavior wise. What are the changes are happening? Whether I'm sleeping properly, or is there actually a sleep disturbance? Whether previously I used to get sleep even the moment I go to bed, but nowadays actually I will be thinking of it a lot of I mean, those things will come, how people were crying, how people were wailing, how people were actually running here, there, asking for help, or how people were confused. So all these things which you have seen in that scenario will be actually coming, and when you're sleeping also, this will start, then you will not sleep. So that's exactly actually that. So you will be preoccupied. So you will be preoccupied means then you will not be thinking all those pleasant aspects. Mostly these are all actually very painful aspects you would have witnessed. You will be thinking about it, and so no sleep, and then you will be slowly, when the sleep goes, then everything actually comes. So the first and foremost actually issue actually which crops up due to stress for the first responders or people who help is that sleep disturbance, then the appetite, and also actually that there will be actually a lot of GI gastrointestinal disturbances, or probably actually you are not eating properly, or even your stomach upset and various other issues will actually you feel bloated, and so many things actually you will feel it. So that is also there, and psychosomatic manifestations will be very common, like uh, bodily aches, headaches. You are not able to relax. So you are always actually in a sort of an aroused mode, because however you want to relax, you will not be able to sleep. You will not be able to relax. So these are all some of the very major points actually that a first responder can actually feel it. And added to that, the work efficiency. So there will be a lack of concentration, a lack of focus, inability to complete a task, or actually inability to get along with the colleagues, or actually communicate with the colleagues, and also angry, this sort of outburst, getting into fights. So increased alcohol. One important aspect is that the one of the major thing actually which we noticed among the first responders or people who work in such emergency scenarios are increased take of substance and alcohol. So there is a I would not deny actually that people don't drink and smoke. People do drink and smoke, but the issue is that there is an increase intake. The tolerance level actually goes higher side. So people who used to smoke 2 cigarettes will start smoking 5 cigarettes. People who used to take 2 pecks will start actually having 5 pecks. So there is actually increase this one quantity and amount of substance to take derive the same actually effect which they used to have it in the previously when they were taking actually 2 packs or 2 cigarettes. So there is an increase actually to actually buffer that to face this anxiety and stress. So that is actually very dangerous, because these are all actually addictive aspects actually that your brain actually start getting adopted to actually these sort of a things. It is just not your physiology. So it is actually also it's all actually goes into there also your mind dimag may actually वो भी actually it actually has a direct connotation. So there will be a lot of neurophysical chemical changes actually also which happens, which also adopt body also adopts to it, because every time when we are facing stress, you are actually your body, your everything is actually trying to adopt, trying to actually face that. But that's what actually that flight or flight response, whether you face it or you run away from it. So that's exactly actually that how we do it. So the way you get adopted to this sort of a substance, then it actually becomes actually an ongoing sort of an issue that will have actually other related complications, like this increased substance may lead to some more fights, some physical fights, or various violence, or many other things actually are there. You all know actually that what is actually complications of alcohol and other things. So it is actually a chain sort of a reaction which may lead actually to, at the end of the day, the well-being of the person who is actually responding to these sort of a scenarios will bring down the will go into an ill-being actually. That so well-being to ill-being actually comes down. Goes there. So that is where actually that the whole thing, what we started, how nicely we started this work, it may not be the same actually after 10 days or 15 days. Now you want to actually get out of this work. You want to actually stop this work. You want to actually go out. You are frustrated, you are angry, and you feel actually inadequate, helpless, hopeless. So you also actually come into the same pictures actually. That. So how we saw in the survey among the survivors, among the people who are affected, at the end of the day, after some point of a time, you will also be the same like that. So from a caregiver to actually you yourself actually a care provider to care seeker actually that. So you need to actually seek. The issue is that most of the first responders are who are responding, they won't seek help, because they will, one thing is that they will not be in a position to understand it, recognize it, their own stress, because they were mostly externalizing everything outside only. They will look at it, they are working, they are actually suffering, they need help, but nobody actually would, inwardly actually look into it, that they also need help. They also need to go and talk to somebody. They also need to share actually their difficulties. They also actually been provided with help. They also require rest. So all these things are actually that they lack it. Second is that usually the people who are in the caregiving profession, they think that they know everything and they are actually immune to these sort of things, and they don't get bothered about these things. And because they have experienced it, they have seen it, and all these things, nothing will affect them. So these sort of a mindset is also there. And third is actually that lack of resistance. I mean, there is a resistance to seek help also. So they don't want to actually seek help. So that is also sharing that actually also in a parallels actually that they feel that it shows their weakness. So that is where many of in my own experience I have seen actually that people don't want to talk about it. People don't want to share it with their colleagues. So how they are affected, how not being with the family, not doing their routines, not actually having a proper food, not having a proper sleep, not able to help the families, how it is affecting them, how they are preoccupied. These things actually they many don't want to actually share, and definitely actually it has actually an impact on their function and other things. So, to my point is actually here is that you need to first of all recognize it and understand these things. Then only actually you can help yourself. Added to that, one important aspect is that I'll not take much time because I have another 5 more minutes only. But when I come to my class, actually, I will discuss with you actually in an elaborate manner. Since today's Dr. Kunal's class I'm taking, because he is not in a position to come today. We will actually put certain, I will put certain important points for you to think and contemplate actually that what is that actually we have seen in last half an hour or so. That the way we handle these things, there are two type of way we can handle it. One is an healthy way of facing these sort of challenges. Another one is unhealthy way of facing these challenges. That's what coping we call it. So our ability to face the challenges. Here the challenge is such a scenario, and how are we actually facing this in a healthy manner or an unhealthy manner. Healthy manners are some of the things actually that catching up with the sleep, properly sleeping, properly having food in time, properly resting, properly connecting with your family and friends and relatives and your support system, and properly actually having a routine, and properly whatever actually you are doing before coming to these sort of work, before getting disrupted. You may be actually listening to music, or listening to doing some painting or whatever it is, whatever the way you used to have your passion, or whenever you were stressed what you used to do would have actually disrupted because of these things. Now this will be this we need to actually resume these things. So are we doing that or not doing that? So you need to actually identify it. Usually people will not do it. When we get stressed, you all know actually that we don't want to talk to anybody. We withdraw from the society, from our relatives, our friends, our people. We want to be alone. We want to be left alone. So these things actually, so definitely there will be a disruption in all these things. So that is where actually that are we actually continuing the things which we used to do it before we actually destroy. So that is one thing actually that you should be always actually keeping in your mind. So second is that you need to also actually start actually doing these things slowly, other than actually taking care of your basic biological functions. And third is actually that environmental manipulation. So going out of that scenario, going out of that place, connecting it spiritually is more important, because spiritual aspect actually plays a very major role in buffering stress. And this is, I am not telling actually that all over the world the studies talks about. So that's where actually that the health is just not about the physical, psychological, social, and other things. Spirituality also actually a good indicator for health. So you have to be actually start reconnecting with your spiritual aspect actually to put yourself back on actually foot, on feet. So that is also the spirituality is also there. So that is where actually that these are all some of the simple things actually that which we call it coping with the stress or stress management strategies, which actually sees a large amount of change in this sort of work. So that is where actually that we need to actually follow these things, resume these things, continue this. So these three things actually that we need to actually keep in mind. So that is where actually that the scenario offers for the first responders. So with this, I'll stop it. And if you have any queries, you can always come back to me when I reconnect with you in my class next time. So in whatever way, short period time, we could share some of the important aspects of stress management for the first responders in such scenarios, for you to actually contemplate and ponder before we reconnect it. So once again, thank you each one of you for your patient listening to me in this session, and hope to reconnect with you soon. See you soon. Have a very good evening. Thank you very much. So I'll disconnect. Hello. You have another meeting, no? 4 o'clock there is a session, so I'm leaving now. Thank you so much. Can I disconnect?
Yes, sir.
Thank you so much.
Okay.